So the last video that we'll look at, or the last video that's content related, we'll be exploring more how we do or use epidemiology. So let's go through our slides, right? We remember descriptive epidemiology, where we're trying to understand like the big picture of how this disease or infection or virus or bacteria or whatever it is spreading. We need to focus on three things: the who, which is the person; the where, which is the place; and the time, right? And I would even think of the how, but a person, you get it, right? Person is important. So who is that person? Age, race, sex, ethnicity, affiliation of group, like where people live. What are their particular biological characteristics, like their immune status? What about marital status? What do they do, right? What are their activities that might be commonalities? And what are the conditions in which people live, right? Remember the example of children who live near this one particular bridge getting asthma. So if we don't know the environmental aspect that the kids are living near this bridge, we're missing out that this bridge or this housing complex in the bridge are the cause or contributors of asthma. We can look at age by age group, right? Are they younger age groups, older age groups? We can look, and this is census, define race and ethnicity in terms of groups. Who are the different groups, right? And in terms of where people live and people who are being impacted by this disease. And then place can also be geography. Where were people born? Where do they go to school? Where do people live? What is the community like? Is it urban or rural? And then these can all help us understand, does place play a factor in where they live, right? We can look at this example. If we're looking at by state, and we'd want to go deeper than state, but unfortunately, right, as a native New Yorker, I'm concerned that there are total number of cases are high in New York and California and not other places. So we may want to make some ideas like what's happening on the coasts that are impacting this rate of disease. And we can see within state, and we can go deeper, right? To see, is it regions within the state, which it most probably is, right? You can look at place, we look at clusters, and this is something that's a really unique way of looking at disease patterns, right? Are there groupings of disease around certain things? Think of John Snow and the well. Were there groupings of cholera around this particular infamous, well or pump A? And so we can look and see, where do they occur, right? Age-adjusted mortality, people are dying in these places more than others. With Giardia, these are where the cases are within a state. You see they're clustered, right? So we want to know. And then we look at time. So certain diseases and outbreaks, quote unquote, are based, right? Flu is winter. West Nile virus happens to be in summer. These are due to seasonal changes and also changes in the lived environment. And then some diseases occur regardless of season. So we need to know that if we're monitoring for flu, we got to start gearing up and looking at surveillance at certain times. And I'm sure you see in your practices more people coming in with flu in winter, right? This is a higher instance of flu. So we just be mindful of time. And we plot time. In epidemiology, both number of cases and time are crucial. So we're tracking, like, is there a spike? Like, for example, here, right? Date of vaccination, right, might also match. Like for flu, you should see a spike in flu vaccination when people are hearing public health campaigns, medical health professionals are recommending it so that people get immunity, get inoculated and have immunity before the time of outbreak. So we're tracking time, right? Day of the week, depending on the rapidity of spread of the disease, time could be a week, time could be an hour, a day, a month, a week, right? How fast diseases are transmitting indicates how we track time. One of the most important things is to look at the epidemiological curve, right? There is the ebb and then there is the flow. Here it was a party where people were infected, right? And then symptoms came on quite quickly. and then symptoms dropped off, right? So we see that in the epidemiological curve, the height of the curve is here. So it looks like they had this party on the 13th, and then late that night into early morning of the next day, and that next day is when the symptoms were happening. And understanding the relation of symptoms to exposure is crucial, right? Think about COVID, think about the flu, think about any disease that you wish to think about. We have to know that incubation period, so we know when people might be infectious, and then we know when we need to look for the next wave in terms of outbreak. Analytical epidemiology, once we do the descriptive part and we know the course of disease, we need to understand more about what's going on, right? So who, when they're exposed, might be at greater risk, right? We can do it through experimental or quasi-experimental design or observation. And I'm sorry to use this analogy, but think about COVID, right? We had students who presented, or people are interested in COPD, people are interested in diabetes, kidney disease, people with those respiratory diseases and other chronic illnesses are at higher risk of a more severe outcome or immunosuppressed persons are at a higher risk when they might be exposed or test positive for COVID. So we have to look at that, right? And see what in this disease is making outcomes worse. In experimental studies, we can do clinical trials, remember the gold standard, or we can do a community trial and just look at the disease over time and take rates and compare. So those in the community who identify with these chronic diseases, who get this infection, what is their outcome? Compare that to people who don't have those chronic conditions. What is their health outcome from exposure? And then observational studies, we can do many of them. Cohort studies, case control, cross-sectional. They don't allow us to have the same level of causality, but they allow us to really observe patterns of outbreak of a disease, and then think of confounding or co-occurring events or other diseases that change the way that a person who becomes infected travels through this disease. We used to call them syndemics. So, and I'll talk about that a little bit later, but a syndemic is when you have two diseases that are outbreaking. Like if you have TB and HIV, those are syndemic. So the effect of both those diseases is more impactful, right? Well, I'll talk about it later. We look at the epidemiological curve. Remember, we talked about that. You'll recall another epidemiological concept is this triad. So it's the relationship of the agent. So what is the disease itself? What is the virus, the bacteria? What is that contaminant, right? And then who does it impact or affect? So is it through animals, through humans, right? How do we where does the disease live? Who hosts the disease within their actual body? And then the last piece is the environment. So what are the extrinsic factors that need to be there? So for the case of cholera, we needed to have the well, right? That pump A. For COVID, we needed to have people who could host the virus, right? The agent we know is the SARS-2, right? And then the environment, we need to have people, because it's respiratory, that virus operates in close proximity, right? Close quarters through airborne transmission, right? So, but those things took time to figure out, but we had to understand host, agent, environment. And then causation, right? So these are ways of figuring out, like, how does that disease work, right? What are the components that contribute to it? What's the cause and what's necessary, right? So A is necessary, right, to cause the disease. So just think like what a causal pie does is gives you a way to understand which is the primary agent causing that disease. And then we track stages of disease. So again, remember, Incubation is when someone is infected with a disease, but may not necessarily have symptoms, so might be subclinical. And then we call it latency, right? You may have the chronic disease, but not be aware of it. So that's important to know, right? When you are exposed to a disease and may have the disease, but not have symptoms, and then you have a clinical stage where you actually, it's the spectrum of the disease where you actually exhibit symptoms and have the disease. And ideally, I want to show you that we hope you get this to this stage of recovery, but it could be disability post-disease or infection, or it could be, unfortunately, mortality, or, which is death, right? So we want to understand, when are people susceptible? Who is susceptible? What is the exposure? When do they have subclinical disease and have some changes? When do they get symptoms? Usually then, after symptoms, get diagnosis. What is the disease like when they have it, the expression of disease? And then what is that post-disease stage? Hopefully recovery, lesser, we hope, disability, and of course we don't hope death, but we need to understand how the spectrum disease, or how the disease manifests within individuals within the population. And then I always say vector, what is the cause of disease? We need to understand here, who is the host, right? The host can be water, it can be a viral, a bacterial agent, it could be an animal, it could be us as people. And then how do we transmit? And I remember working with HIV, this was one of the most contested, and I'm sorry to say, problematic things. A lot of people felt, oh, cause of disease for HIV was anything, right? But it's not. We know that it was bloodborne, right? Bloodborne or fluid-based, right? Look at COVID, right? COVID, right, is airborne. COVID has, the vector disease is not food. It's not an insect. It's not insect-borne like some things, some other things, like think of malaria, or think of other diseases that might have other paths. So we need to understand who's at risk. How do we transmit from one person or entity, animal, to another? And then how do we get the disease? Is it through blood? Is it through droplets and inhaling droplets? Is it through drinking or eating? We need to understand this path. And this is an old diagram, but it's still what we use in the field. So think about the chain of infection. How do you receive a disease? How do you, an infectious agent, how do you share it? How do you transmit it? If we know transmission and we understand who's susceptible, we can use barriers. If we know COVID can be transmitted person to person through, which is airborne, we then can use PPE. If we know it's through blood and it's through, sex or sexual intercourse, we can use barrier methods. If we know it's through water, we can provide ways or alternate ways of getting water or food. So it's really, really important to understand how that disease is spreading. And think of yourselves working in a healthcare environment. You can also protect other patients and yourself when you understand that vector of transmission, right? Is it, if you have a needle stick and you have a bloodborne disease, you're going to want to go and get tested. If you, are around someone without PPE and they have COVID, or they might have TB, you might want to also look at, getting tested. So what is the relationship? So ways to think about it. I'm going to bring up syndemic here, but I want you to think about different levels or different scope or impact of disease. The first level of disease is like endemic. So you find a disease that a community is having higher risk of this, higher rates of this disease, but it's contained to a smaller community, right? Epidemic is when the number of cases start to rapidly increase, but it still seems to be contained. Pandemic is what we have with COVID and other diseases, where that epidemic is spread across countries and continents. And epidemiologists will argue that these are important to define because they relate to protections that we offer, or surveillance and monitoring of a disease, but you want to make sure you know the level at which a disease occurs. When I mentioned syndemics. Syndemics are kind of, they're really insidious or problematic because they're two conditions that work together that really become more lethal or more virulent. So think of a syndemic would be like we have an outbreak of TB in a population that has HIV, and the combination of both those things, right, being immunosuppressed and getting a pulmonary disease is quite dangerous and or lethal. So we also look at syndemics, or two either epidemics, endemics, or pandemics that occur together and synergistically work to affect a population. So you may hear syndemic, and I wanted to share that. Again, how do we track? We do incidence first. What's the number of new cases, right? So who's getting this disease in a population? Is there a spike? And then we look at prevalence, right? The cumulative number of all cases over time. So incidence is the first marker when we see that red flag go up and there's a spike in the number of cases. But we also want to track how many cases are available over time. So you think even more about why you would use incidence and prevalence, right? So to close, I want you to think, as you're all working in, health fields, what is the relationship and what's our role as health professionals in monitoring disease outbreak, right? When I worked with HIV or TB, we always monitor incidence and prevalence rates. With COVID, with other diseases, we have dashboards and toolkits where we can look at these diseases over time, right? And what is our role in surveillance and kind of looking and saying, gee, there's a spike in this. Think of your professional practice. Do you see patients who have a higher level or higher or worsening cases of COVID or COPD, or do you see, a spike in the number of people coming in with flu? Because you are the front lines and you can report that and see maybe we have another strain of the flu that the flu shot is not working against, or maybe we have something that's coming up that we need to see. When I worked in clinics, we had HPV among adolescents, right? Seeing this come up. So you understanding it, we saw strains of HIV that were very different virally than other HIV. So I want you to think that epidemiology, which is the cornerstone of public health, you're really at the forefront of it, because when you sit with a patient or individual client, you can really see some of these trends before they happen, do the observational work, do the reporting, and really help impact disease, which I'm sure you all have done. So I'm going to close the last video and I'll post this online so you can all see it on Blackboard.